Hello. So for this week's journal assignment, I will be discussing a recent encounter with a patient. It was a young lady, and she worked in IT, and she was complaining to the nurse practitioner that she felt overwhelmed and she felt stressed due to her job. She had been taking some medications because her diagnoses were major depressive disorder and ADHD. She didn't have any issues with her medicine that she named, but she did state that her job made her stressed because her supervisor was always pointing out the things about her that he felt were wrong versus giving her, positive feedback when she had good days at work. But every day she just felt like he just always named everything she did wrong, and she felt like it was taking a toll on her emotionally. The reason why this specific encounter stuck out to me is because the nurse practitioner, she not only started to review some things with her that she can do when she gets home to help manage her stress as well as managing her stress at work, but she also went online with her job title as being working in IT, and she went online and helped her to look for different job opportunities in her area that she would be interested in. This was very, very, very important to me because I felt like people are always interpreting or feeling like a nurse practitioner or a psychiatrist or even just a regular medical doctor that the only thing they do is prescribe medicine, which this is part of what they do. But to me, this was so significant because not only she had already prescribed her medicine, but she was very supportive for her in different ways. It's like she went outside the box to me because it wasn't just talking about medication management, but it was also, she was also being supportive with her and helping her to find other ways of location where she could work because she felt like if it's taking that much of a toll on her, it can start to affect some of her psychiatric diagnosis. I know a lot of healthcare professionals will say, or maybe you should change your job, or maybe you should get another job. But I've never actually had a situation where I actually witnessed that person go online and help that person to try to actually find another way that they can, be stress free by finding another job. My strengths that I felt during this encounter was also being helpful in, listening to different things that she could do. It also made me active where I was looking as well for her in, the area that they're in, that she lives, to help her to find another job that she felt supported and just she felt like the job actually, felt like she was doing what she was supposed to do instead of always feeling like she didn't do things right. A reflection on my therapeutic use of self, same thing, just helping her in being therapeutic and also offering different types of ways that she can manage her stress at work by like stepping out if she felt like it was just too much at that moment, taking deep breaths, things like that. And the nurse practitioner also did encourage her to do some CBT because she felt like she could work on some different ways to help manage her stress as well. Because even though it is an option for her to be able to find a job, it might not be something that can be done overnight. So until then, when she can find another job, just ways to help her manage the stress and also just being able to have a voice and ask telling her to talk up for herself and let him know how she feels versus just taking it and feeling bad because maybe with his type of personality that he has, he don't understand that he's hurting her feelings. Now if she did open up and tell him he continued to be that way, that would also give her more of a reason to know that she needed to find another job. My specific learning and insight for this was support. Like I said, a lot of the doctors and nurse practitioners, we expect, not myself, but a lot of people feel like, oh, all they do is prescribe medicine. All they do is, something like try to keep you medicated and not help you in different ways. But I witnessed from her myself, and I plan to use in the future. My future practice is being supportive of patients in more ways than just telling them what medicine to take and what forms of therapy to take, but actually being supportive for them, and helping them with their personal life because I felt like that was helping her personally by helping her look for jobs because some of the jobs that the nurse practitioner located and seen online for her, she hadn't seen. And she was just excited. Like, I remember one particular job, she was like, oh, yeah, I remember we used to go there when I was a little kid. I would love to, be IT there. And those are the things that I think makes the nurse practitioner very special. And the impact that they have on their patients is wonderful because, like I always say, being a nurse first, allows you to be empathetic and sympathetic and understand your patients a little bit better versus just saying, okay, do this and just keeping it moving. But actually letting them know that you do care and you want them to be better and that you'll help them take those steps to do it. So that's the biggest insight that I learned from that is just being supportive for your patients in more ways than just managing their disease process, but just being supportive for them in your entire role. And that's about it. Thank you.